through the histology stuff first, then we kind of do all the other ones and fill them in. But since we're here, let's talk these. As I mentioned, during pregnancy, the placenta will produce estrogens and progestins, and they have the exact same effect as the other ones do. But there are other hormones that are produced by the placenta as well. Because after all, not only do we have to develop a baby, but we have to prepare mom for both the pregnancy and the birth as well. One of the things that is produced by both the ovaries and the placenta is a hormone called inhibin. Because clearly, having a lot of estrogen is good, having a lot of progestin is good. We talked about if you don't have enough progestin, then you can't maintain the pregnancy, and that's something that's very tragic. However, does that mean more is always better? No. We talked about the importance that estrogen plays in maturing the egg. Right now, typically, how many eggs do you mature in a month? One. That seems really inconvenient from a reproductive standpoint. Wouldn't it be much more convenient if you could mature an egg in as little as 10 days? So every 10 days you were ovulating, and 3 days after that you were menstruating, and that every 2 weeks you were going through the cycle. Wouldn't that be way better?
Only a male. Exactly.
I'm strictly meaning from a propagation of species standpoint. But you absolutely have the right idea. The point is that while more is good to extent, there is a point where more is too much, too fast, too much. So to regulate these processes, to regulate the production of estrogens and progestins, to regulate the rate of development of the eggs, we have an inhibitory hormone that is also produced by the ovary, known as inhibin. Right? If you think about it, all of these processes we just talked about are basically controlled by luteinizing hormone and follicle-stimulating hormone, which are produced and released where? Anterior pituitary. So if we produce too much follicle-stimulating hormone, we mature the eggs too fast. And that would be a bad thing. So how do we slow things down? Yeah. Inhibit the anterior pituitary. Stop the anterior pituitary from producing and releasing as much follicle-stimulating hormone or luteinizing hormone to maintain those processes.
Is it both? It decreases the production of both?
Both, but primarily follicle-stimulating hormone.
Okay.
Yeah, it targets the gonadotropins because the hypothalamus actually, the releasing and inhibiting hormones that are produced are actually gonadotropin releasing and gonadotropin inhibiting hormones. So it does produce both. But in this case, it's really follicle-stimulating hormone that we care about. Yes?
Could you repeat why you don't want too much progestin?
Again, just too much of anything is a bad thing, right? You can die from drinking too much water. So obviously we want to maintain processes at an appropriate rate. If there's too much of something, that can have a negative impact. Right, we can mature the eggs too fast. We can, I'm not sure what an effect of, I can't think off the top of my head of an effect of too much progestins, but maybe you can get an overdevelopment of the mammary glands or something along those lines that could occur. So more is a bad thing, right? But here's where it gets interesting. How do you think, so let's actually do the drawing for this. Here's the anterior pituitary. It is releasing its luteinizing hormone and its follicle-stimulating hormone. And that follicle-stimulating hormone is stimulating the follicular cells in the ovary, causing it to mature the egg. All right? However, if the amount of follicle-stimulating hormone goes up, our stimulation of the ovary goes up, and our rate of egg maturation would go up, and that's a bad thing. So it turns out maturing the egg, making estrogens, would also go up. But these follicular cells in the egg also produce inhibin. So if follicle-stimulating hormone goes up, not only does egg maturation go up, not only does estrogen go up, but inhibin levels go up. And that inhibin then inhibits the anterior pituitary. So how would you say inhibin is regulated? Hormonally, by follicle-stimulating hormone. The more follicle-stimulating hormone, the more stimulated the ovary is, the more inhibin it makes. And the opposite's true as well. If you're not producing enough follicle-stimulating hormone, right, inhibin production goes down, and if inhibin production goes down, you now have less inhibition on the anterior pituitary, and what's going to happen to the levels of follicle-stimulating hormone? They're going to increase. So yeah, so this is regulated hormonally by follicle-stimulating hormone. All right. Yes.
So I watched your video and I think you understand this.
So that's true for males. So in males, it's going to be slightly different. So we're going to talk about these processes in males, and we'll get more into it in reproductive. In reproductive, there are both humoral and hormonal, but in this case, it is hormonal.
So it's directly stimulated by the...
Yeah, the follicle-stimulating hormone stimulates the follicular cells, which make inhibin. So the more they're stimulated, the more inhibin they produce. So yeah, so that is directly hormonal.
Can you repeat what the human chorion and gonadotropin is?
It maintains the corpus luteum. So that so if you have the corpus luteum, remember, is making estrogens and progestins. So normally it's maintained by the luteinizing hormone. When the luteinizing hormone goes away, the corpus luteum goes away. But with the human chorionic gonadotropin, even when luteinizing hormone goes away, the human chorionic gonadotropin maintains the corpus luteum, so estrogen levels stay high and progestin levels stay high.
That's only after the egg has been fertilized.
That's only after the egg has been fertilized, exactly. And there you go. So human chorionic gonadotropin targets the ovary to primarily maintain the corpus luteum, which keeps our estrogen and our progestin levels high and allows us to maintain the pregnancy. Notice I'm not putting regulated here because what makes the human chorionic gonadotropin? Yeah, a fertilized egg, exactly. There's one more hormone we want to talk about in relation to pregnancy, and that is relaxin. As I mentioned, not only do we have to worry about maintaining the uterine wall, developing the mammaries, right, developing the baby, but we also have to get the body of the female to adjust, ready to accommodate not just the expulsion of that baby, but the growth of that basketball within inside of their belly. A lot of movement, a lot of materials has to take place. So luckily there is a hormone called relaxin that is released. This relaxin basically targets the muscles and ligaments of the female, allowing for the accommodation, right? We're not there yet. This won't be on the exam. But it's always a fun chart to look at. There's that basketball. Look what it does to the bladder, smushing it on the pubic symphysis, what it's doing to the colon, what it's doing to the small intestine and the liver, shoving all these things out of the way. There's a tremendous amount of accommodation that has to take place when that pregnancy occurs. And so relaxin helps to loosen those ligaments, loosen those muscles, allowing for that accommodation. right? One of the things that is a common perception is that when an individual is pregnant for the second child, they often show earlier, right? That's a common thing that happens, that they show earlier. It's not so much that they're showing earlier, it's not that the baby's growing larger the second time, it's that the body has already made these accommodations once, so reestablishing those accommodations, loosening of those ligaments and stuff like that, typically occur much more readily the second time. So it isn't that the baby is going faster, it's just the body is accommodating more rapidly because it's already done it once.
What does it exactly affect? The joints?
Ligaments and tendons primarily, but you're right, it affects joints as well. One of the big ones it affects is the pubic symphysis. Right? The pubic symphysis is that fibrocartilage joint between the two pubic bones of the pelvis. Right? And so one of the things relaxin does is to help to loosen that joint, make it more flexible, make it more bendy. Right? So again, to accommodate the passage of the baby through the true pelvis. Of course, because of that loosening, we know the pelvis is the center of our gravity and balance. So typically a pregnant woman, especially a late-term pregnant woman, gets a very distinctive gait to the way that they walk, right, because of that loosening of the pubic symphysis. And notice I didn't say walk. All right, questions on that? All right, excellent. So there you go. Modifies the female baby for pregnancy.
The inhibin is made by the placenta and the ovaries. What's the relaxin?
Relaxin is produced just by the placenta.
Okay. And same with the.
Well, human chorionic gonadotropin is made by the zygote, right? The fertilized egg.
And the regulation is the same, it's just one.
These two you don't have to worry about regulation because this is pregnancy and this is a very complicated thing that we're not going to worry about. Yeah. Well, joints, there are other joints that can be affected as well, other parts of the body. Yeah, it allows for the relaxation. It plays a role in helping to increase the metabolism of the female. I mean, there are a lot of effects of this thing. And again, we could spend, and in fact, there are whole classes on development, and reproduction and development. So I mean, we could spend a whole semester talking about these things. So we're painting with broad strokes here, just to get the basics of this. And we'll talk about some of it in more depth when we get to the reproductive system. But like I said, even then, you could spend the whole semester talking about these things. And people do. All right, now we get to the bug. Questions on this before I erase the board?